Many people struggle with hair growth or regrowth. Women have that sense of satisfaction that after the trimming session their hair will grow back, and men think that the bald patches in between the hair will come back. But certainly it does not happen. Hair growth can stop due to various reasons including genetics, aging, hormonal changes, medical conditions, and lifestyle factors. Also, other factors might include stress, poor nutrition, and certain medications that can also affect the hair growth cycle, leading to hair loss or slower hair growth. Now, let's know it from an expert what a person should do for hair regrowth and whether it's possible or not.
Hair loss is very common these days, both in men as well as women, and the most important cause for hair loss in both men and women is familial and genetic, which is called as, the name speaks for itself, hormones and genetic factors, androgenetic hair loss. The other causes for hair fall are deficiencies, which can be because of iron, zinc, vitamin D, and calcium. Sometimes it can also happen because of poor diet in the form of poor protein intake. Hormonal factors can also contribute, especially in women. Postpartum hair fall, that is hair fall happening after delivery, hair fall because of thyroid factors, hair fall because of endocrine factors like polycystic ovarian disease, autoimmune factors like alopecia areata, in which circular patches of hair fall develop on the scalp, is also common. And then lastly, it can happen because of infections like fungal infection, tinea capitis. Now, why suddenly we are noticing the hair loss is a very common thing, but suddenly why we are seeing hair fall in young people, young teens, early 20s, and there are a lot of people, and sometimes it's very saddening and disheartening to see people with bitemporal recession, receding hairlines, patches on the scalp, something that we used to see in 40s. So children presenting with these kind of complaints, and I think the main reason is the stress, which can play havoc with your hormones. This stress can be because of the competition, the competitive exams, the peer pressure can lead to a lot of stress, and that can contribute to a lot of these hair falls. The other difficulty can be because of deficiencies of essential things like iron, zinc, vitamin D, as I mentioned, calcium deficiencies. A lot of chemical treatments on the hair these days, and young children and teens going for these treatments like chemical treatments, hair straightening. You mentioned keratin, hair straighteners, the heat treatments that undergo, and those chemicals and those colors and dyes which are used on the hair can also contribute to hair fall. Lastly, it can be because of a poor, everything that we use, everything that we consume, fruits, veggies, they contain a lot of pesticides. They're grown using a lot of fertilizers, and these chemicals can also contribute to hair loss by altering your hormones. Drinking water in plastic bottles, that's something which can alter your hormones. First, to treat the hair loss, you have to find the reason why it's happening. If the reason can be found out, if the diagnosis is made correct, then there's certain hair losses which can be treated easily, especially alopecia areata, in which the circular patches which appear, which can be treated with certain lotions. If it's a hereditary cause, it's an androgenetic cause, the treatment is prolonged. You can try it initially with certain medications like minoxidil and finasteride, and if that is not sufficient, then you can combine it with PRP. And if there's too much bitemporal recession, then you can go for treatments like hair transplant. Sometimes hair loss can happen because of nutritional deficiency, which can easily be corrected by correcting your iron levels, zinc, calcium, and vitamin D levels. If it's because of stress, if it is because of surgery, remove the stress. The ones which are caused because of surgery or postpartum or once the delivery happens, they usually correct by themselves in a matter of 5 to 6 months.